This year, in the United States, over 13,000 cases of cervical cancer were diagnosed, and almost a third of those women died from it. Did you know that cervical cancer is preventable, though? A simple screening that can take less than 10 minutes could have saved many of these women's lives, but a lot of women are choosing not to have the screening. Think about it. It takes most people more time to get up and get dressed in the morning than it does to have this screening that could prevent this deadly disease. For average risk women, the American College of Obstetricians and Gynecologists recommend the screening be completed every 3 years from ages 21 to 65 unless the results are abnormal or the patient has had a total hysterectomy. After the age of 30, the screening can be extended to every 5 years if HPV testing is also added to the pap smear. So that's about 11 times in a woman's life that she will have to get screened. One way to decrease the risk of getting cervical cancer is to limit the number of lifetime sexual partners and get the HPV vaccine. The human papillomavirus is the #1 sexually transmitted disease as well as the main cause of cervical cancer. It is so common that over half of sexually active people will get the disease at some point in their lifetime. Prevention of cervical cancer should start during early childhood by receiving the HPV vaccine between the ages of 11 and 12 and can be given up until the age of 26. While men are unable to get cervical cancer, they should still receive the vaccine during their childhood to prevent the spread of HPV. Every vaccine given decreases the chance of spreading the disease and also helps reduce the risk of those who are unvaccinated from contracting it. The cervical cancer screen is a test that not only detects cancer, but can detect HPV, precancerous cells, or cervical abnormalities that could lead to cancer. It is much cheaper to have the screening and be able to treat the precancerous cells or an early stage of cancer than it is to wait and have a late stage of cancer and not know it, which could end up racking up expensive medical bills. Over the years, cervical cancer screenings have significantly decreased one of the most common causes of death in women, but there's still room for great improvement. Cancer does not discriminate, and all women have the potential to develop cervical cancer. Without the screening, though, you may not even know that you have cervical cancer until one of the late stages. There may not be any warning signs. The screening is vital for women. I urge you and your children to get vaccinated and encourage others to as well. This is the only vaccine available that can prevent cancer. If you're 21 years or older, you should make an appointment to get screened. And for more information and recommendations, you can visit the website of the American College of Obstetricians and Gynecologists.